I'm back. Um, so I'm basically covering a lot of stuff, a lot of things that I've been thinking about and, worrying about. And so the last 6 weeks has been really hard for me because I couldn't really physically do very much for myself. I'm getting to the point now where, I can raise my arms to a certain extent, which you guys can't even really see, but I can raise my arms to a certain extent, but there is a point where the skin becomes too tight across my chest, and I don't really want to push it. Um, I'm happy with my chest. I'm satisfied with the way it looks. I feel like Dr. Garamoni did a really great job and did an even better job explaining to me what I should expect. And there's nothing about my chest that I didn't expect from the get go. So, that's great. That's wonderful. My problem now becomes changing the things that I am the only person that can change those things. I can't look to a doctor and say, I need this fixed or that fixed. I need to fix those things myself. And it's on a personal level of um, discomfort or uh, feeling like that is what's going to make me feel better about myself, or in some cases more masculine, um, or have a more masculine appearance. Um, and I'm not really even gonna get into uh, the psychosis of that. Um, Other things that have been going on, I still, I don't know, some of you that have been watching since last year may remember that the end of July last year, I had some issues with my girly bits, um, and had to have one of my ovaries removed and have a uterine ablation. The issues that I had basically stemmed out of me feeling extreme amounts or pretty severe amounts of pain um, in my pelvic area, and so the doctor at the time had kind of assumed that, well, I think that we're looking at probably, endometriosis, whatever. So she went in just basically looking for implants, whatever, and found nothing but a tumor on the back of the left ovary. It was a benign tumor, nothing to really worry about, nothing that even had an indication of a strong progression into a malignant tumor. The type of tumor that it was is known to cause severe amounts of pain, but there's a low chance of it becoming malignant. So they removed that and the ovary that it was attached to. Um, so this year, I've gone to have my yearly physical and my yearly exam, and I talked to her about the things that have gone on over the past year, which pretty much I was assured that the pain would go away after the tumor was removed, that it was probably the tumor causing the pain, and the pain has not gone away. So I go on the 30th of this month, which I guess is in like 5 days, to talk to her because for some reason there's some odd policy. I don't know if it's just in the state of Pennsylvania or if every gynecologist is like this, but they cannot talk to you about surgery during your yearly exam. They cannot perform a pap test and talk to you about surgery in the same visit. I don't know what that's about, but so I go on the 30th to talk to her about a hysterectomy, and then should soon thereafter know when I will be having the rest of the girl bits out. Um, So that's coming up soon, soon. Which, it to some extent I have mixed feelings about. Um, it's for me. It's not. I feel like I would want them out anyway, but um, I have concerns about hormone levels, bone health, and those things. Which is why I'm glad that we have an actual appointment just to talk about the surgery and what the effects could be. Um, the fact that I could still, even though I'm on testosterone, I could still go through a very severe form of having the hormone levels there, even as suppressed as they are, to having no hormone levels, and it could cause a very severe menopause effect, which would happen basically it will feel like to me in a split second, because I'll go into surgery with the hormone levels, come out, and whatever's in my system will work its way out, and that's it. There's nothing else creating more. Um, so it's a big decision. She is she really wants me to think about whether or not I want to have everything else out, but leave the remaining ovary. To our knowledge, there is not a tumor on the remaining ovary. Um, so it's a hard decision to make, and it's a lot to think about, um, and a lot of stress in a lot of situations. I now have almost no contact with my mother. Every once in a while, she will call me to ask me things about my sister, or ask me to ask my sister things. Um, but I almost have no contact with her. I have no contact with my father. Um, and my oldest sister and I have very limited contact. So that's life. That's life in my world right now. And you know, with Catherine being out of work, we're struggling in other areas of our life. Struggling financially, struggling with being in each other's space too often sometimes. Um, but that's about it. We're muddling through, and if anyone has anything that they can suggest or add for anything that I've talked about in these last two videos, I would appreciate it. If anyone has any information that they can give me, or think that I need to know about a hysterectomy or hormone levels, or the effects that the loss of hormones will have, please share them, because I can always use more information. I'm, constantly doing my own research, but if you have a personal experience that you would feel comfortable to share, please do. Other than that, that's about everything for today, guys. I'll talk to you guys soon, and I'm sure I'll probably, in a week or two, do another update about chest or testosterone, or I don't know, something crazy. Who knows? Have a good day, guys. Bye.